Welcome to The Community Table, a discussion series about real life with diabetes. Community Table is presented to you by the JDRF-Beyond Type 1 Alliance and made possible with support from Abbott, Lilly, and Dexcom. Hey everyone, I'm Tiana Cooks, Senior Community Manager from Beyond Type 1, where our mission is to help people with diabetes stay alive and thrive. This is our Community Table, a monthly series where we have unfiltered and honest conversations about life with diabetes. Today, we have the honor of speaking with Austin James of Austin James and the Nomads. Austin is a recording artist who was diagnosed with type 1 diabetes in 2005 and openly shares his stories about being an artist and a performer while navigating physical and mental health challenges. Austin has shared the stage with national acts like Hawthorne Heights, Need to Breathe, Switchfoot, and the Neon Trees. You can currently find him in a series of summer and fall shows in the Northeast U.S. Hey, Austin, thank you for joining us.
What's up, Tiana? How are you?
I'm good. How are you?
Well, thank you.
Good. Well, welcome to the Community Table, and thank you so much for being willing to share your story with us today. So to kick us off, when and how were you diagnosed with diabetes?
I was diagnosed back in 2005. I was 17 and in my senior year of high school, and I had gotten pretty sick and was kind of wasting away. And I had a classmate of mine who had diabetes, and I kind of knew the symptoms. And to confirm it, I checked my blood sugar on his on his equipment. Don't do that. And it was really high, so I got rushed to the hospital, and my life's been different ever since.
Wow. You literally used your friend's meter to check your blood sugar?
I did.
Oh my gosh. Don't do that at home, but if you need to, you gotta do what you gotta do.
Exactly.
Okay, so you were 17 years old at the time. Do you remember how your life changed after you were diagnosed, if it changed at all?
I had lost so much weight. I was a dual athlete in high school, and soccer was like a passion of mine. And I was, getting recruited at the college level, and I had just lost so much weight that I was struggling in every aspect of my life: energy in the classroom, and obviously energy on the field. And it was difficult once I was diagnosed to figure out how to put on weight again, and making those dietary changes and wholesale lifestyle changes.
Right.
I had to be subtly conscious of this great big monster in the room that I had no idea about.
And you were diagnosed at an interesting age, because when you're 17 years old, you're getting ready to become an adult. You're going to turn 18. You're going to graduate from high school, and then you have to navigate college and that time just being a young adult. So was that any challenging for you?
Oh, absolutely. I didn't know much about diabetes outside of if you eat too much sugar, you're gonna get that. But obviously that's nonsense. But in the community, it's that's our reality. We don't.
Right.
Right. So it was tough. And then when I got to college, oh goodness, I'm on my own, and I'm in upstate New York, and I'm trying to deal with this thing. It was a nuisance.
Yeah. And that kind of leads me into my next question, because I think, navigating type 1 diabetes and having health issues, but also being a young adult, so many things, right? So as we address access, what do you think the biggest challenge was when navigating the healthcare system and getting access to the care that you needed? And how has it looked throughout this process?
So when I was diagnosed and I turned 18, this was pre-Obamacare. So I wasn't on my parents' insurance. I had to get some really bad medical insurance through the college. didn't really cover much, and I had to really like hustle in college, do a lot of side jobs and this that
Hmm.
to afford a $120 little bottle of insulin.
Right.
Then you get into rationing, and it was really bad. It was very challenging, and I got really sick my second year of college. So it it was difficult, and trying to break those bad habits
Right.
on was a challenge as well.
Ugh, like my heart like it hurts hearing that story, because that's not how life should be for anybody. It's tough. So when you were going through all of that, like how did you even find out your college had an insurance plan that you could be on?
I had gone. I had had an episode of some sort where I needed to go down to the campus infirmary or whatever it was called, and found out through there. And I've never been hospitalized for my diabetes outside of
Good.
um, my diagnosis, so I'm really
Hmm.
fortunate in that regard because I've always been really in tune with my body, probably because I've been
Right.
an athlete my whole life. Um, but there were those little challenges where I would run out of insulin or I would run out of supplies, and I really needed to go and figure out a way to get those at an
Hmm.
affordable rate. It was
Yeah.
too much for a
Yeah.
young man to handle. So,
Right. And
but it
then
made
you're working all these like side jobs just to
it.
afford insulin, but people don't remember like when you're in college, you're probably working jobs that are paying like minimum wage. I've been there before. And then you're also having to pay for like textbooks and all of the other things that come with college on top of your like medical supplies if your parents aren't helping you out with that, and that's really tough.
It was tough. It was tough, and my parents helped when they could, but I mean, it's
Yeah.
expensive. It was expensive.
Did your you said like now you've gotten or you found out about Obamacare. So what exactly was that plan, like that healthcare plan when you shifted from your college to your current or the insurance that you shifted to?
Yeah, so I was able to get on my parents' insurance and
Okay.
through my dad's job, and
Hmm.
I had that till I was 26 or so. I think that was the cutoff. But suddenly I was able to afford an insulin pump. I
Yeah.
was able to have access to insulin and whatever supplies I needed, and that was that was definitely a burden easer right there. So
Right.
it was difficult before that. So I had a lot to celebrate when that went into effect, and it
Yeah.
definitely changed my life and gave me access to what I needed.
Right. That's a big, big deal. And sometimes people think that access is just about like accessing, your insulin, but it's also about accessing, general health care, like having an insurance plan, accessing resources that you need, like educational tools, accessing mental health providers. Like there's a lot of different layers that come into play when you are talking about access, right?
Yeah. Oh.
So
Mm,
yeah, it's a heavy conversation, but it is a big one that I think is important to have, especially for people who might be struggling navigating, you know, accessing whatever it looks like today with their diabetes. Yeah.
absolutely.
Um, so for people who aren't impacted by diabetes, what would you say the biggest misconception that you've seen about accessing the tools and care we need?
I don't. I've run into a lot of misinformation with people that don't have diabetes, whether it's about
Hmm.
saying, oh, it's diet related or this, that, and the other. But I think it's just their lack of understanding about the severity of diabetes. We're literally
Right,
choosing to keep ourselves alive every day.
right.
We are taking on the job of a, you know, non-functioning pig. So,
Yeah, like an
it
organ
has
that's
other
not working.
functions, but like we have to be our own insulin delivery system, and
Yeah.
that's a lot, and it's a lot on our mental health. So I don't think people quite understand the severity and the layers there. Um, so when they talk to you about it, when they broach the subject, it
Mm-hmm.
it can be overwhelming, and it used to be for me to inform them. But I think the more work I've done in the community, the easier it's gotten for me to kind of use
Mm-hmm.
those moments as teaching moments, and
Right.
really inform people like, hey, these misconceptions here, they're wrong, but they also can be really dangerous.
Right.
Let's shift focus to this. This is what it's about, and
Right.
to the intricacies here. And everybody's different. Not everybody's diabetes journey is the same. So, but there are those basic things that
Mm-hmm.
have that line there that we can kind of come together on and figure out.
You mentioned the community. Like, I think that's big, especially because, even when you were diagnosed, like you met somebody who had diabetes, you used his meter, and then you found out you had diabetes. So, like, knowing other people does make a difference when you can reach out to people and ask questions. Like, if they're having, maybe they're having some troubles navigating insurance themselves or trying to figure out, like, where you got your CGM from or your pump, like that is the best resource in my opinion. So that way you can figure it out together and you can ask questions from people who are experiencing it, right?
Yeah.
Like, I mean, I think that's huge. I also just wanted to mention, because you were talking about at one point in college really struggling to afford insulin. I've been there. I think a lot of people who I've met have also been there, and it's tough. And I wanted to just toss in this little follow up for anybody who may be watching this and who is having a hard time with insulin cost. We at Beyond Type 1 have created a tool called getinsulin.org, and you can pop in some basic information about your circumstances, and the tool gives you an action plan. Really cool. And it gives you options, so cost-saving options available to you for the insulin that you need. So that's at getinsulin.org. I highly recommend checking it out if you haven't already. It's just a great tool. So wanted to hop in and just throw that out there.
Right.
Yeah. What other resources have you used, or what would you recommend that people look into if they are, experiencing issues with access?
I think God, even when I was diagnosed, there wasn't much, but I do remember pretty much the only resources I did have were through JDRF, um,
Mm.
and that continued because they put out such incredible information, and then through them finding information through whether it's the Mayo Clinic or the American Diabetes Association. Currently it's obviously Beyond Type 1. It's great hearing and seeing other stories. That was kind of my introduction into the diabetes community. I think it was one of the first conversations I ever had was with you, and it was incredible finding this big family, and it's gotten me more involved in the community as well. So I'm so grateful to Beyond Type 1 for giving me access to community.
Austin, don't make us cry.
True.
No, you're absolutely right. I think when I was first diagnosed, I was like, I don't know where to find this information at, especially access to educational resources around diabetes, right? I think there's a lot of information out, like when you're originally diagnosed and you're just now learning what to eat and, how much insulin to take and how to count carbs. And then there's these layers, right? Like we live with diabetes for our whole lives. So we constantly need information and we constantly need these educational tools to continue learning how to best manage our diabetes. So I think Beyond Type 1 was also one of the first like resources that I found that kind of spoke to me, right? It was like, these are like real life issues. It was relatable. And just honestly, I'm not being biased, but like one of the best resources that I've been able to find. So thank you.
Thank you.
Great answer. Um, well, I just have a couple more questions for you. And the next one is just like about advocacy. So I would love to know like how you've been able to advocate and what advocating for yourself looks like even in the doctor's office. So I know you advocate online.
I do. So when I was on a pump break for a few years, and some technology started to come out with the CGMs and whatnot, and I really wanted to switch and get some freedom because being a musician, I use my fingers and my hands all the time, and the finger pricks got so painful. I mean, it was really hard, and you get to the point where you stop checking your blood sugar like you should, and you kind of go off how your body feels, and that's not good. Don't do that. Um, so I went through about anywhere from 5 to 7 different endocrinologists before I finally found one that like listened to me. So access to good doctors is also a whole thing because you can get stuck with a doctor that works in a really big busy office and they just don't have the bandwidth to kind of have that more personal care level of care, and it's understandable. You know, they do a lot, but obviously that didn't work for me. I needed help. I needed access to not just an endocrinologist, but to a therapist and to different specialists that could help me with different areas that diabetes had impacted. Um, so I finally found one, and I've been with her for a few years, and she's amazing. Uh, Old school, and she tells me like it is, but I need that.
So, for anybody who is experiencing issues or has any barriers that they're facing, like what advice could you give them?
Just to be vocal, advocate for yourself, whether it's with your doctors or your general support, it's people around you, whether it's parents or siblings or relatives, whoever's helping you, whoever's supporting you. Be really vocal and be honest about what you're going through because more often than not, they're not going to understand what you're going through. And I just think self advocacy is really it's vital um, to our survival, to our mental health, and to our physical health, of course.
Oh, that's so good. Dropping knowledge on us, Austin. Yes, don't ever stop advocating for yourself. Um, that's one of the things that I'm still learning how to be better at. Speaking up to doctors is not always the easiest thing. Like calling different insurance numbers or healthcare providers, it's hard. Like these people are professionals in what they do. But as long as you keep, fighting for whatever it is that you need, that's what matters. So be an advocate always. And so let's get into something a little funner, a little bit more about you, Austin.
All right.
When did you get into music and how has diabetes impacted your career?
Oh goodness. All right. So started playing piano when I was 4 or 5. Had some lessons with my mom and with some other instructors, and she, my parents told me if I stuck with my music lessons that I could pick an instrument when I turned 10. And I did that, and I chose the violin, and that's been a fun, wild ride. Gotten to play with with a lot of people in a lot of different capacities, which is wonderful. And getting to play in Europe was kind of the highlight too. So that was amazing. But I think let's see, I started songwriting probably right after my sister passed away in 2009. That's when I really started like putting pen to paper and music to those words, and I haven't looked back. It's been a really wonderful and challenging and rewarding career. And then throwing that added layer of diabetes on top of it, it really makes you self-reflect a lot and just be conscious of your present moment. Because oftentimes we get bogged down in the past or look to the future, but I think as diabetics, we really have like one foot firmly in the present because we have to. So that trickles into every aspect of my life, and music has been my outlet, and it's been a healthy outlet. It's not always easy,
right?
but it's when I'm my most honest and transparent, and I'm grateful for that, and I'm grateful for how my diabetes is so interwoven into music and my career.
Yeah. I think that's really something that not a lot of people can connect, like when you're dealing with something that's tough. I think music, like you said, it can be a great outlet, especially for someone like yourself who's been into music since they were like a little tiny 3-4 years old. I mean, I think that's just incredible how you've been able to use your music, not just to impact, others' lives, but how it's really molded and shaped you as a man and as a person. That's big.
Yeah.
So this is my favorite question. Which of your songs is your favorite, and is there any meaning behind it?
Ooh, you're gonna make me choose. Probably, goodness. I have to go 1A, 1B. I'm sorry. I have to. So our most recent single, we released it last year. I wrote it and recorded it down in Nashville with two incredible songwriters and producers, Asher and Danny. And it's called She Loves You. And it's kind of a it's a rough journey through love and jealousy.
Oh, it's a love story.
It's a whole thing. It's lots of emotions. And you can find that on Spotify. I'm gonna plug myself.
Yeah.
It's wherever you listen to music. But on the opposite end of that, our last full album we released in 2021, and my favorite song off of that is called Like Lovers Would Do. And that's a super romantic song, so if anybody's with their boo, dance along to that. Real
okay.
nice. That's my favorite.
I am here for that.
Yeah.
We will be sure to plug links to your platform so everybody can check out the music. I was going to ask you a question about that too. Like, where can we find you at? You said Spotify, iTunes. Where else?
And literally anywhere that you can possibly listen to music. Just go to austinjamesandthenomads.com, and we have links to literally everything. Tour schedule, music, what's coming up, because we're recording an album soon and I'm really excited. So
lots coming up.
Lots.
So we're just getting started hearing about Austin James and the Nomads.
Yeah.
More to come. That's awesome. I think you're one of my favorite artists, not being biased, but I just think it's so cool, like supporting people in the diabetes community who are, taking up space in other areas, like in the music industry and so on. I love it. And you've inspired so many people using your own platform. and being vulnerable and not being afraid to share your stories, the highs and the lows. You share all of it.
I do.
Yes. And that's so admirable. I don't think a lot of people are comfortable all the time talking about, like you just sat here and talked to us about access when it comes to diabetes, or mental health and diabetes, and all of the good, ugly that comes with having diabetes, right? So thank you. Thank you for taking up space. And I just want to close out. I have to know, you continue, like I said, to show the world what it looks like to live beyond your diagnosis. So as we close out, what is some encouragement that you have that you'd like to share with someone who is newly diagnosed with diabetes?
Yay. I get to use my favorite tagline. It gets better.
Thank you so much, Austin. We are so appreciative of your time today and just grateful that you agreed to join us and spread some knowledge and encouragement with our community. If you or anyone that you know is struggling with access to insulin, we encourage you to visit getinsulin.org, where you will be able to find and create an action plan personalized for you. We also recommend becoming a member of our Beyond Type 1 app. Here, you will be able to join a community of allies, mentors, and friends impacted by type 1 diabetes. The app is a wonderful way to connect with others, share your story, and find resources and support for not only people living with diabetes, but people who are thriving with it. So we hope to see you there. Thanks for listening to this episode of The Community Table, presented to you by the JDRF-Beyond Type 1 Alliance and made possible with support from Abbott, Lilly, and Dexcom.